Hello, I'm Brian Frere, and I interviewed Timothy Girdhart, a PhD student at USF, as well as a professor and a behavioral health technician. So the first thing I asked him about was the journey, how he got to where he is now. And he spoke to me about being a psychology major and after he graduated, becoming a behavioral health technician. And through 5 years of working there, he noticed a lot of sort of systemic flaws that, in his opinion, prevented patients from receiving the best treatment possible. And he felt that rather than working with one individual or changing the culture in one hospital, he could make the greatest impact by getting a PhD and being able to advance his career and work in policy, where you can change the culture and approach of multiple hospitals over a wider area. So the next thing I asked him was about the type of skills that are needed in this field. And he spoke to me, the two biggest things were patience and empathy. Patience, because there are going to be a lot of setbacks. There are going to be individuals who aren't necessarily receptive to certain styles. There are going to be struggles that are sometimes out of your control, sometimes different things, but it's just being able to keep at it and keep working and continuing to try to grow and being patient, that knowing that you're making a difference. Whether this person is maybe struggling in a way that a previous patient didn't, that's completely valid and okay, and just continuing to be patient and to take satisfaction from your work. And then empathy, just genuinely being able to connect with them and understand them, because we're all human and just want to be understood. And especially a lot of these people with mental health concerns, because of the stigma, they haven't really had their voices taken seriously, or they feel like they're unheard sometimes. So it's just something that you can make a lot of big progress and make a big impact on their life just by being there for them and understanding them and connecting with them on a human level. So the next question I asked him was, can you describe a typical day at your job? And he spoke to me about the main thing he does is case management. So with individuals who are Baker acted, he'll go over their case files and kind of determine whether they're best suited for inpatient care or outpatient care, depending on a variety of factors, mainly if there's suicidal ideation or homicidal ideation, as well as psychosis. So in that case, because they're not stable, they would be best suited for inpatient care, where they can be taken care of and ensure that they are safe and that no one else is in harm's way. And then the other part of his job, which is less frequent but something he still holds in high regard and still values a lot, is working one-on-one with patients from time to time in case treatment, just going over them and kind of recommending them to resources and kind of setting goals for them of, okay, like, do you have somewhere to stay? What is it that you want to do? Where do you want to be in 6 months? And kind of working with them on that level. So the next question I asked him was, how do you stay current with your profession? So as a PhD student, he always has to stay current. He's always studying, taking tests, reading research papers, kind of staying on the cutting edge of what's going on in terms of behavioral health. But he also spoke to me very candidly about the perspective of some of his older colleagues, and how there can sometimes be a bridge between academics and academics and people in the field, where he said, like, some of the older colleagues have directly stated, why I have 15 or 20 years of experience to fall back on. I don't believe this researcher who has no actual experience working with patients, I don't think that what they are saying or what they're showing has that much merit, or it's not something that I'm going to take into consideration because I feel like I know more, or I feel like they don't actually understand the complexities. So that was something that was very interesting. Like, how do you address that gap? Because it can be hard. The next thing we spoke about was, does he belong to any professional organizations? And the main one he spoke about was the American Psychology and Law Society, which is essentially, they hold conferences where you can network and connect with other professionals and kind of bounce ideas off them, collaborate with them on research or peer review articles or different things of that nature. So kind of another way to have access to other professionals, to kind of get outside perspective from your own and to inspire and learn from one another. And the next thing we spoke about was how the work of your agency contributes to the well-being of the community. And we spoke a lot about how case management, the importance of that, kind of determining whether these people, like, what treatment would be best for them based on their needs and their specific situation. So for some people that might be inpatient care, for some people that might be outpatient care, but definitely that's something that's extremely important, because you don't want someone who isn't stable to get hurt or to hurt someone because they didn't get the treatment that they needed. So case management can definitely be very important at preventing that from happening. So the next thing we spoke about was what was the most valuable lesson he learned working in behavioral health, and it was just being able to be patient, have empathy, but also to separate your personal life from your work life, because a lot of people, especially full-time employees, they can hold themselves to an impossible standard, and it could lead to a lot of stress and unhappiness in your own life, where there's a phrase like taking work home with you, or you're taking all those problems and those issues with you, where there can be even sleepless nights where you're thinking about something that you could have said or could have done differently or could have improved upon. And that's something that there's a careful balance. You always want to do your best, and you want to help these people as much as you can, but also recognizing certain things are out of your control, or even if there was a mistake that you made personally, holding yourself accountable but not making yourself suffer for it is very important. Like, you always want to do your best and improve, but you have to learn from things rather than kind of holding them against yourself and lowering your own confidence in your own mental health and kind of self-esteem. The next thing we spoke about was what advice, or like what are employers looking for in young people applying for behavioral health. So they don't necessarily have the same resume as like a 35-year-old. If they're 22, fresh out of college, they don't have the experience or necessarily the recommendations that someone who's more experienced would have. So the main thing he emphasized was passion and willingness to learn. If they have those two things, then they're going to receive consideration, because it's an investment. They're someone who's willing to learn, who wants to improve, who is always trying to do their best for their patients and for their community, and that's something that's always extremely valuable. And that's something that he says he can pick up on right away. In interviews, you can tell when they're really genuinely trying to learn, like they're asking questions, they're asking for clarification, they're discussing certain topics, they really want to learn more and to grow and to try to come up with new and innovative ways to help people in their community. That's all the questions. Thank you.